Welcome to the Face Podcast. I'm your host, Masoud Saman. On this podcast, we've explored the face as a biological marvel, as a social anchor, as a lens through which we can examine humanity. In my surgical practice, I'm often deep within the anatomy of the face, the muscles, the nerves, the physical structures that allow us to interact with the world. But today, we are shifting our focus a little bit. We're shifting from the physical hardware to the complex neurological software that drives it. Joining us is a true polymath of a human, Dr. David Matsumoto. Dr. Matsumoto is a professor of psychology at San Francisco State University and the director of Humintell. He is perhaps the world's foremost expert on the universal language of the face, proving that whether you are in a bustling metropolis or a remote village, the micro flicker of a muscle can reveal the deepest truths about the human psyche. His work isn't just confined to the laboratory, though. Through Humintell, he has developed rigorous training protocols used by government agencies like the TSA, FBI, and other global agencies to sharpen their ability to read intent in high-pressure situations. David is an 8th degree black belt in Judo and a world-renowned judoka. Having coached the U.S. Olympics judo team and traveled with them, he understands perhaps better than anyone the intersection of physical discipline, the heat of competition, and the involuntary leakage of emotion. Very excited to have this conversation with you today, David. Welcome to The Face.
The pleasure's all mine, and I'm very tickled that you actually thought about me.
Well, look, this is a podcast about how the human face shapes us and how we're shaped through the human face, really. We're looking at humanity through the lens of the face. I'm a facial plastic surgeon. Every day I deal with kind of the hardware, the structures of this tool of communication that you study so deeply. And I could even say that your studies are in the software department, really, how we get this information out through this hardware. And I thought that would be a very interesting intersection for us to chat.
Well, thank you very much. And I to study up a little bit. I've watched some of your previous podcasts with other people, and it's fascinating. This is such an informative topic that can be examined from many angles, as you know.
Absolutely. It's truly fascinating. And it's really, the passion that I have for facial plastic surgery, I have come to learn is not just about the surgery. It's not just about changing a structure, or else I would have gone into probably pottery or sculpting. It's truly about how we affect this device of communication.
Yeah, absolutely.
And I've read a number of your papers over the past week. Fascinating. Over 400 papers.
I mean, 400 are the community, the combination of papers and the conferences and all of the academic works and whatnot. And I'm very blessed because I used to have a large laboratory staff that did a lot of work,
Yeah, absolutely. So let's get into it, David. How did you start all this? What got you interested?
I knew you asked that of others as well. So here, I'll try to make a long story short, but to tell you the truth, like other guests, I did not think I'm going to spend a career doing anything on facial expressions or emotions or anything like that. I mean, if anybody knows me in my personal life, they'll think that I'm probably the least emotional person or around. To make a long story short, when I was an undergraduate at the University of Michigan, I was studying psychology, which also was not I was in the pre-med program moving along until I decided not to do that. And I happened to be in psychology, and I happened to do well in it, even though I didn't know why I was doing well in it. And a professor came to me and asked me to be part of the undergraduate honors program. And I said, sure, what's that? And he says, well, you got to do a study. And I said, great, what's that? And he said, well, what kind of research interest do you have? And I said, and this is true then, and it's still true today. And I have an interest in why infants can understand their caretakers caregivers, especially their mothers, on an emotional level without understanding language. So that led me to one of my first study as an undergraduate thesis a long time ago. When I got into graduate school, my advisor at the University of Michigan suggested I go and talk to that guy over there in the San Francisco Bay Area because I happened to be coming to San Francisco, and his name was Paul Ekman, and Ekman was was a pioneer in research in this area, and so I looked him up back in the day when we wrote letters on typewriters, and I sent him a letter and he sent me a letter back. And in 1981, in September, I got into graduate school and I visited his lab and he invited me to be part of his lab. And here we are 40, 50 years later. I mean,
Amazing.
I had no plan. I'm the type of person, I start something, I would just keep doing it and I'll do it and do it. And here we are. I mean,
No,
that
I know how that goes. And it's fascinating, really, how the story gets written sometimes. And that's
sure.
sometimes more interesting of a story than when we try to force our own plan onto it.
Yeah, for sure. For sure.
You study, in large part, micro expressions, amongst other things.
Mhm.
And I was just thinking, before I get into like the nitty gritty of it, just from a evolutionary standpoint, it seems like micro expression leakage of emotion, especially in a high pressure situation, sounds like a pretty bad idea from an evolutionary standpoint. How did this come about? Why is it that we still have this ability, or should I say, is it an ability though, or is it something we try to suppress and we cannot?
Well, I think it's more of the latter, but you have a really interesting question about why micro expressions occur in the first place, in terms of our evolutionary history or whatever theory of origins we adopt, right?
Hmm.
And to be sure, micro expressions are very quick, extremely brief facial expressions of emotion, as you and many of your audience knows. When people have single emotional episodes, our expressions go on and off the face from between a half or 4 or 5 seconds, which is a long time. Micro expressions are those expressions that occur under half a second, and they're occurring generally when we're, as you said, we're emotional, but we're trying to control, suppress, or repress our thoughts and feelings. Um, Darwin, back to your original question, Darwin originally stated in his book, The Evolution of Emotion in Man and Animals, that he stated a hypothesis called the inhibition hypothesis, which was the thought that people could not completely suppress all of their emotional urges, uh, because sometimes they're just too strong and they'll leak out. Now, but you do ask an interesting question. If they're occurring in high stakes situations, and people might, if they occur, they may then give the others the additional clues as to what one's actually thinking. However, most people don't see them, and those who see them see something but don't know how to interpret them. So that's the side that allows them to occur and still exists within our history without giving up the goods, so to speak.
Yeah.
So because most people don't see them, and some see something, but they don't know exactly what it is.
But if we wipe somebody's face off completely of micro expressions through whatever method, let's say we design a study where we can do that as a control group and put that in front of the observer, does the observer see that face as strange or unusual, um, not having any micro expressions?
Well, I think it depends upon the situation that we're talking about. I mean, related to your question, as where I went first when you asked me that question, are studies of EKG and evoked potential in the brain, where people are not consciously seeing the micro expressions, but their brain is registering somehow. And even if they're not micro expressions, we have longer expressions that are just brief, that unless you're really paying attention to them, you're not consciously aware of them. However, I do believe that they are being perceived and processed in the perceivers' minds, and thus they do affect perceivers' minds, whether they are consciously seen or not. And so, whether people, well, there are two premises of your question, right? Can we wipe them out to begin with? And again, when I said that depends, it means if you put people in a really highly emotional situation, but they got to really try to control their emotions, I happen to think that they're impossible to suppress given good questioning. Um, and so really getting rid of them is a difficult situation. You can get
Mhm.
rid of them, of course, if a person is talking about some tangential topic where they're not emotional and they don't have to hide it in the first place. But on the perceiver side, clearly, even though people are not consciously aware of them, they are being registered and they affect interpersonal interactions.
Okay, so the presence of a microexpression could signal a lack of congruence between what is being said and what is being felt.
Absolutely. Absolutely. And it may not necessarily be deception in the way that many people think about, right? I mean, I may be having a pleasant conversation with a good old doctor, and part of my mind goes to the fact that I had this fight with my wife last night. I did not, but I have I had my part of my mind might still be there. And as you know, whatever we're speaking about is only a fraction of the contents of our minds at any one time. And
Right.
whether they're micros or any other part of our nonverbal behavior, sometimes that stuff just comes out in our behavior. And it may or may not be deceptive in the sense of what I'm lying about what I'm saying right now. It may only mean that I've got other things on my head
Right.
that are also being expressed.
Yeah, and that comes up in normal conversations every day where
Sure,
you're
of
like, "Hey, are
course.
you with me? Are we?"
Yes,
Yeah, you see a flight of thoughts, and
of course,
that can happen.
of course.
Which is more important or more powerful in conveying a message, the verbal cues or the nonverbal cues?
That's a topic that's been studied quite a lot, and so one way we first start to think about them is whether, well, first of all, you're exactly right. There are verbal cues, and then there's the what I call the nonverbal packaging of the words in terms,
Mm.
and that the packaging along with the words give us the total communication package. And when our words and the nonverbals are consistent with each other in terms of their meaning, like if I say, I'm really angry right now, and I use my voice and my face, I'm pounding myself here, it doesn't matter, right? Because they're all giving the consistent message. When your question becomes really relevant is what happens when the word content of the words are incongruent or inconsistent with the content of the nonverbal behavior. And so studies over the last 50, 60 years have studied those situations, and they're pretty consistent that the vast majority of the messages being communicated and conveyed and perceived, when the messages are inconsistent non-verbally and verbally, most of that stuff's going to be perceived non-verbally. Depending upon the study, it's 65 to 95% of the messages communicated are going to be the non-verbal stuff and not the verbal stuff. And so that gives you an idea of how powerful the non-verbal messages are, especially in the face, even though we may not be consciously processing them.
That's quite interesting. One of the training courses that I sent my staff on early on was about how to, phone etiquette and how to deal with clients and patients that come in, etc. And one of the things they took away was that when you pick up the phone, whatever you say it with a smile. The person across the line will see that smile even though it's on the phone. So small inflections of the voice can carry through, I believe, the emotion that's supposed to resonate with it. And then the lack of that, I guess, I spoke with a Broadway casting director probably about 6 months ago. One of the things that now just talking to you came to my mind was that he was telling me about how they look for authenticity in an actor. How the he didn't use the word the term micro expressions, but
Sure.
he said the way they changed their brows, or they
Sure.
smile, or a little smile, or the tiny little things that you may not pick up on. And he did a little exercise in front of me where he said, I'm going to go from happy to sad without changing my face. And he just looked at the camera and he went from happy to sad, which I cannot do. But tiny little things changed. I mean, of course, something
Sure.
changed, but
Sure.
you could see that the face completely is now telling a different story.
Sure. Well,
And
you're making an interesting point. The first one about the staff answering the phone and whatnot. So, and here I am. I'm going to talk to you about anatomy, what I think about anatomy, right? But it's pretty clear to us that that the innervation or the activation of the facial muscles is connected to the activation of the vocal cords, and that's why we all can hear when the other person's smiling, and we can always hear when the person's frowning, et cetera, et cetera. And there are distinct vocal cues, paralinguistic vocal cues that are associated with each of those emotions that are associated with the faces. And I happen to believe that because they're tied together, once you start doing something like that, it's hard to. I'm smiling. It's difficult to say something in an angry tone of voice because my facial muscles are telling my vocal cords to go a certain way when I want to go the other way. I mean, it's impossible. It's like wrinkling your nose in disgust and telling somebody you love them, right? And
that's right.
you get
Yeah.
that nasally disgusted vocal tone, which kind of doesn't do that. So they're all connected, which is an interesting thing. And that's certainly one of the reasons why everybody can hear and know when we're smiling and know when we're angry, not only from the voice but also when we're on the telephone, even though we don't see each other.
Going back to which is more important, verbal or nonverbal, sometimes I find myself wanting the nonverbal to be stronger while the verbal says something non-offensive. The nonverbal, I want it to say something else.
Mm.
As an example, I have three girls, three
Oh,
daughters,
oh,
11, 9, and
oh my
6.
goodness. Oh my goodness. Oh,
It's
good luck to
fun.
you. Good luck to you. We'll talk
I
in
know
10 years.
you have 1 and 3 boys. At least you can take them down, with a
Yeah.
couple of your judo moves.
Yes. Yeah.
I can't even do that because immediately they'll be, but daddy, and then
Yeah.
I have to stop.
Yeah.
Um, but one of the things is sometimes I find it more powerful they say, "Can I do this?" And I say, "Well, sure." But I just said no. And they hear that. But if I say no, they'll say, but why? I want to do this. All my friends are doing it. You're so strict. Da, 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 da." It goes on. But when then the nonverbal message seems to sink in more. Or another example, I come home from work, my mind is elsewhere. I try to, by the way, and I hope everybody does this, kind of wipe away all the troubles of the day on the mat before I walk in. It's not fair to them that we take all that home. So I
Yeah.
try to not bring it home. But from time to time,
Sure.
something's on my mind. And they just look at me at dinner from across the table. Daddy, you okay? And I don't feel like I'm doing anything different. If anything, I'm smiling more just to mask it.
Mm.
And the ability they have to pick up the most minute nonverbal signaling is fascinating. And I find that perhaps we lose some of that as unless they're trained professional like yourself, who this is what you do. I mean, I cannot imagine that you look at a face and you can divorce your analysis of expression from what you're here. I imagine you're both are running in your brain. I don't know, correct me if I'm wrong, but I feel like as we get older and with cultural shifts and diversity and thinking that different people may have different expressions, we kind of lose that. But you argue that these are universal. They're all over, everywhere in the world.
Yes. Well, I've got several points. First of all, um, let's count ourselves as lucky fathers when our kids are interested in how we are, because that's really a blessing in disguise, because a lot of families right now are just, even though they're together, they're not together. right? And a lot of that is being driven by, I think, the electronics around us and society in general, et cetera, et cetera. And this is tied into what we're talking about. What you mentioned about what your kids are perceiving is similar to what you mentioned about the stage director, right? It's about authenticity, and we all unconsciously learn to perceive others and observe others, especially those whom we're close with, and we have a good baseline about what their behavior is like. So when then something is different, they can we those who are interested, and again, thank goodness they're interested, they'll say, hey, are you okay, is everything all right, even though they may not be able to break down technically what's the difference. And you're right. I mean, people like me, I'll break down the difference and say, well, this muscle didn't move this way, and this muscle did this other thing, and this was asymmetrical over here. The rest of the normal world is doing that on global inferences, and which is great. And so there is something to be said, back to the original the stage actor, about authentic expressions, and that authentic expressions have a certain way of being, have a certain way of a timing characteristic, if you will, a symmetry in the face, et cetera, that gives that the perception of being more authentic and genuine. And in fact, studies have shown that when people are spontaneously producing emotional expressions, they have certain timing characteristics that are different when we voluntarily produce them, because we got different neural tracks going on down there. And people will know that, and people will see the authentic versus the non-authentic, or spontaneous versus voluntary expressions, and perceive the spontaneous ones to be more genuine. And they may not be able to break that down exactly why it is, but people can make that perception. And so it's very interesting. It's tied into all of what you just talked about with your family, and the person there, the stage director earlier, because that's the system that we've got ties together all of that stuff in a certain way when we are simply emoting without filters.
Yeah, and to take that back to again children and family and close bonds, because well, that you have better in the case of children and especially babies, there is a survival need to recognize these expressions.
Of
So
course.
you look at a baby and the way they're without not even understanding what the mom is saying,
Yeah.
the baby kind of gets it, right? Knows when the mom is not happy or
Right.
whatnot. But even with people that you know very well, this can happen. I'll give you an example would be if I go home and my wife, something is off. I can tell, because I've known her for so long and I know that there's
Sure.
bad consequences for me if she's mad, so I better pick up on it very quickly. And yet there is a complex communication going on because she may be upset about something, yet through what we refer to as emotional regulation,
Sure.
at least in the domain of plastic surgery, is how you suppress or not suppress, but regulate the amount of that emotion that you want to show. Because at the same time, you're thinking, well, this is my husband, this is, we have children, whatever. You try to make the problem go away. You learn how to work through these things.
Yep.
But the other person picks up on it, even though
Mhm.
you're trying really hard to hide that you're not happy that day. So this comes from years of being together. How do you train through Humintell these agents? What do you ask these people to look for in strangers to identify these micro expressions that are lasting less than half a second?
Well, first of all, thank you for that. We train people, and we train anybody, whether general public as well. But most of our work is in law enforcement and national security, and that realm. But anybody can be trained to see micro expressions. I mean, it's a very acontextual training that what anybody can do online, and that's the easy part. The harder part is negotiating that context that you're talking about right now. So you see somebody have a flash of anger or disgust or fear or whatever that may be. What are you going to do with that is the question, right? And what you do with that ranges from do nothing to do something, and this do something can range as much as subtly bring it up, or hint at it, or be direct, or things like that. And everything's contextual at that point. It depends upon your relationship. It depends upon how long and the purpose of that interaction. I as a general rule, if it's somebody I care about and I want to hear them, I want to give people the opportunity to express themselves, because the other thing about this is emotion is energy, right? When emotion is being created in our minds and we see that in our faces, it's turning on a whole system in our body that primes our bodies for action. And so there's psychological energy, for lack of a better term, that's being occurring in our bodies. And so one of the things I'd like to do is to give people the opportunity to dissipate some of that emotion energy by talking about it, because when we keep it bottled up too much, that, over the long haul, that doesn't do anything good for our health, our mental health, or our physical health, and all that kind of stuff. And I think for me, it comes down to simply showing that you're interested in others.
Yeah,
And
absolutely.
which is what you're talking about. I mean, say like your kids, hey, dad, is everything okay? You're not judging people, you're not calling them out, you're giving them the opportunity to speak a little bit more. And if a person at that point says, I'm fine, and walks away, okay, that's that at that point. But then other people might say, well, now that you brought that up, blah 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 blah. And I always think of these perceptions of expressions, whether they're micros or not, as potential gateways for future conversation. And that's how I teach it. That's how I understand it. They're potential gateways for future conversation.
I love that. I love the way you put it. I think exactly the same way. I've just never put it into words.
Yeah,
That even that example of I'm fine. There is that again
yeah,
incongruence between how
sure.
how I said it and what I said,
Yep,
and that begs additional inquiry.
absolutely.
In what I do, whether when I was doing reconstructive surgery or now that I'm doing more aesthetic surgery, we are changing the very structure of this tool of communication. Let's
Yeah,
let's take the simplest example, botulinum toxin, which is a medication that we inject into muscles to soften wrinkles, to
yep,
it also affects expression.
sure.
I'm injecting it into the corrugator, into the procerus, into the frontalis
Yep,
muscle, the same muscle that gets activated when you're surprised or mad or whatever.
sure.
How does that affect authenticity? How does that
Well,
affect when I say I'm not happy, but I can't grimace?
yeah. So you're the expert on that particular. It's my understanding, and please correct me if I'm wrong. Is depends upon where the exact site of the injections, and where you're actually placing that, and the strength of that, and how long that's going on, and whatnot.
I
One
guess
thing,
I guess what I'm taking this, David, is
yeah,
not so much about the technical part of it,
yeah,
but more about the introducing. I guess is rhetorical. Yes, it does affect
yeah.
that congruence, and
Well,
I wonder if uh, just spitballing here, but I wonder if this creates the taboo that exists about plastic surgery. And
well,
we,
I think it can. I think, I mean, let's take the extreme version of that, right? Like people with Mobius syndrome who cannot move their faces at all. And so then it's as if they've got the almost total facial paralysis, right?
right,
And there is well documented in psychological research about the social difficulties that they'll have, because people have difficulty perceiving them and perceiving their emotions. And that then leads to a lot of other potentially negative consequences, unless those people, those perceivers, have to learn to perceive things differently, essentially. And then what's really interesting about that is, in the people with Mobius, they're emotional just like anybody else. So the central command system that produces emotions in our brain is just firing away. It's simply that the facial muscles cannot move. And also it affects, as you know, speech articulation, because we got to move all these little muscles down here. And so if that's the big picture of facial paralysis, yes, then you're if we're immobilizing certain other parts of the face as well, certainly I think those kinds of effects do occur, and can have potential ramifications for social interactions.
yeah, we see that in that kind of a, as you said, extreme example. Even still extreme, but a little bit less and more common is Bell's palsy. We have
Yeah,
patients
yeah,
who
sure.
have hemifacial paralysis,
Yep.
partial or full,
Yep.
and they often are bothered more by the implication in social interaction than they
Yeah.
are by what actually they see in the mirror.
Yeah.
That I look angry or I look
Yeah.
indifferent or whatever,
Yeah.
and that seems to play. Another thing that I've spent a lot of time on is caring for children who are born with facial differences, cleft lip and
Yep.
palate,
Oh yeah.
Treacher Collins,
Oh
etc.
yeah.
And that's another situation
Yes.
where you're now signaling one message and then you're also verbalizing another message. And that lack of congruence, again, is what's causing a lot of the social stigmas that go with this.
Yeah, and what's even more unfortunate about it is that the expressor, him or herself, doesn't know that, right? Because he can't see your face. They're just being themselves.
Hmm.
And it takes from my what I understand, I think it takes a lot of understanding, knowledge, and then understanding and practice to get over that initial. I don't know if it's a stereotype, but I think most people have a way of interacting, perceiving the world with quote unquote normal faces and normal expressions and normal expressivity that it throws us off. It throws us off when we don't have that normality around us.
Well, it's well studied that if this machine for communication is broken and you're looking at it, you're spending more time and your more attention into
Sure,
decoding what's going on
sure.
as opposed to listening. And then, of course, there is this mistrust that's created. I'll venture to say
Yeah,
trust
yeah,
becomes the issue because authenticity goes under question.
yep.
Back to the Botox conversation. Early on, Botox was introduced for cosmetic use in the late 90s, but it was initially used in the early 80s for spasms around the orbicularis muscle. And they
Mhm.
start noticing that, oh, when I do that, now no longer these crow's feet are gone, and they started using it in aesthetic medicine. Early on, people were always afraid of becoming very frozen. And
Mhm.
now nobody wants that. Now they're doing this other thing called baby Botox, much lower dose in very specific areas, kind of like a high definition TV, more pixels, smaller pixels.
Yeah.
And we're seeing that, okay, patients are doing better, but there's also a cultural difference. I don't treat, at the risk of oversimplifying and overgeneralizing a culture, but I don't treat my Japanese patient the same amount with
Sure.
Botox that I do my Italian
Of
patient.
course. Of
My
course.
Italian patient wants to move the brows, wants to, express, whereas my Japanese patient perhaps is a
Sure.
calmer, yeah.
Yeah.
So culture plays a role in this, and I know you looked at expressions across cultures in
Yeah. Well,
the Olympics. Tell us
well,
about that study.
Well, so the expressions across cultures, especially about the ones that are the expressions of emotions that are in the face, all are the same universally across cultures. There's no question about it. But what that's overlaid over the topic that you're talking about, which is the physiognomy of our skulls, and then how our skin is laid onto those skulls, and everybody's got a different physiognomy, and
Yeah.
different physiognomies by themselves can look expressive, right? And so even so technically it's correct, the same muscles are moving, but people have very large differences in the physiognomy to begin with, number one. And then there are cultural differences in the amount of expressivity, not in the type. So in the type, people anger will still elicit the same pattern of muscle movements. Sadness will elicit the same pattern of muscle movements. But it's well documented that there's differences in the amount of the intensity of the activation, and then there's differences in the amount of the intensity of our facial animations and all the other kinds of behaviors that we do. And so what you're talking about there is are those are being responsive to those kinds of cultural differences in overall expressivity given people's different physiognomies. Because I can imagine now, and I'm guessing here that you've probably got people that you've treated, they could be from the same culture or even ethnicity, but with a certain physiognomy. I'm guessing, right, that you might go one way, but with another, with a different person with a different physiognomy, you may recommend something very different because it has different appearance changes there.
Absolutely. No, it's correct. The anatomy, of course, plays a big role in this. The patient's desires, their social upbringing. There's a lot that goes hand in hand.
Yeah.
Um, you know, the glitches, not the glitches, the flickers rather, the of microexpression.
Mm.
Do you think that, or in your studies, have you come across whether or not these are the brain's attempt at suppressing the bigger expression that otherwise would have shown? Is that what it is, or
Yeah.
is it something else?
So
For
yeah,
example,
I think you're exactly right. I think what's happening is that when we're emotional, the part of our brain that's driving an emotional reaction is located in our subcortex, and that subcortical area is saying when you're emotional, fire the system. So the system is firing my face, firing my voice, turning on my CNS, my ANS, and all. So you got a system that's going on there. Fortunately, many people have this thing called cortex, right? Where we are thinking about other things, including what's socially appropriate.
right?
So that and especially when we may be talking with others, we're managing their impressions of ourselves anyway. And so we may be entirely like I'm talking to the boss, and my boss may have given me a negative feedback, or even what I think is an unfair feedback. And that'll trigger the subcortical areas of my brain saying fire anger. So now I'm really pissed, I'm really angry, but the top of my brain is saying, okay, you probably don't want to punch the boss, and so I've got this tug of war going on in my brain over
Yeah.
control of that facial nerve, sometimes the bottom wins out, and that's when you're going to see the leakage. That's why we call it leakage in those expressions. But yes, exactly, when you're emotional and you're trying to control it, and maybe for entirely socially appropriate reasons, but you're emotional, you're trying to control that emotion.
Yeah, and this is, I assume, is a learned skill, right? I mean, early
Sure.
on, a baby just cries. I don't, you take away the toy, they will cry, they will throw themselves to the ground. Little by little, they learn, okay, maybe I should be hiding this. Maybe
Yeah.
this is not appropriate in front of the guests.
Yeah.
And so they learn that. I have a colleague, Mark Manny. He's a
Mm.
prominent, very outstanding plastic surgeon. And in one of his lectures, he said plastic surgery can make you either more aligned and authentic or make you an imposter,
Oh,
because plastic surgery of the face specifically is essentially affecting that communication tool we
yeah.
talked about earlier. And
Yep.
now I'm thinking about all these other modalities and technologies that affect how, at least in the digital world, how you and I are seeing each other affect communication. Beauty filters. I'm a big um, proponent of regulation around the use of beauty filters that children and teenagers have on their
Sure.
phones
Sure.
and so on. Well, it softens lines, it makes expressions less strong and less authentic, and the smile becomes a little bit different, and everything changes. And I wonder if there is a plastic part of our brain that is going to change what over all these years we've developed evolutionarily to respond to a certain expression. And now with filters and things like that, how does that affect the way we recognize and interpret signals?
Well, the filters will, of course, change how we perceive the signals and what we think about them. I don't think, however, that the way our hardware is for perception that will change what our brains think is an authentic, spontaneous emotional expression of whatever emotion we're talking about. And so the filters will also always be thought about as filters.
Yeah. What
Yeah.
do you think about AI? How is AI face affecting things? I mean, many people can spot an AI generated face without really knowing why. They look at it, the face is
Yeah.
flat. Maybe
Yeah.
there's a lack of micro expression. Maybe there's a lack of, I don't want to bundle micro expression and expressions of
Sure.
brief duration into one bucket, but
Mm.
um, how is AI going to, are you going to teach AI the micro expressions?
Well, we've got different let's see, potential avenues where we're exploring that kind of possibility. I think it's like any tool, you know. Like any tool, there can be really good social benefits from that tool, and then there's really not so great social consequences from the use of that tool. And like many tools, I think it comes down to the hands of the person who is using it and what their intention is for everybody else. And I think there's both of those to occur. And that's why I hope, related to your comment earlier, that we as the public can become more aware of what the pros and the cons, the risks and the benefits from all of the technology that we have around us.
Yeah, absolutely. It's just, so many unknowns with
Yeah.
that.
Yeah.
David, we've talked about deception and in the training of government agencies and detection of that, culture, evolution of the muscles, all of this stuff. If you were to strip away the kind of the mask of social etiquette, like the not punching of your boss, for example,
Okay.
and kind of the software of culture, right?
Okay.
The Italian versus the Japanese expression, that
Sure.
kind of thing. And we were left only with the raw, spontaneous facial expressions of a human being in kind of their most vulnerable state. What would you say is the fundamental truth about humanity that the face would reveal, that something that nothing else can do, not that only the face can reveal?
It is the center of the only universal language that we have across all of mankind. Wherever you go around the world, we will all understand each other on the basis of our facial expressions. That cannot be said of language or anything else. Faces have that great universal elemental basis.
It's powerful,
Yeah.
and I couldn't agree with it more. It took me probably 15 years to realize why I even do what I do.
Yeah.
It's just crazy. I
Yeah.
spent a lot of it, doing it because I was told to do it, and then doing it because I learned to do it, and that was my degree, and so on. And it wasn't until recently, the past few years, that I realized uh, my entire job is to create authenticity
Yep.
for individuals who look at themselves in the mirror and they don't see that authenticity, or
Yep.
others don't perceive it.
Yeah.
Um, and that to me is the definition of good plastic surgery. And the opposite is the definition of bad plastic surgery.
Yep.
The inauthentic, overly pulled or overly filled faces that say to us that is not an authentic human face,
Yeah.
or Botox that's done too much, or whatever
Sure.
that doesn't allow for expression.
As I was thinking about our upcoming conversation, um, I can only imagine, as you said earlier, and I know this to be a fact as well, which from personal experience with my friends and documented by research, that a lot of people with some anomaly, whether it's a facial anomaly, an expression anomaly, or something like that, they don't see it. They're just themselves. And for a lot of them, the larger problem they have is their interactions with others because they're perceiving them. And as I was thinking about our upcoming conversation, I just cannot imagine how I don't know if joy is the right word, but how much, well, let's call it joy, that one can bring in your profession to people who can close off that or address that problem in these people's lives. Again, it's not them, it's just their interactions with others. And I think bringing that in line is such a great benefit for these individuals who can receive such treatments, if you will.
Oh,
Um,
you're absolutely right. It is joy is the absolute correct. Yeah,
yeah,
just yesterday I was walking, I got out of the train and I was walking toward home, and I was thinking to myself, how lucky am I to live inside of my dream? 25 years ago, I was thinking about taking the MCAT and then start this and do that and work in this lab and go to medical school and
yeah,
do this training, that training, all of which I didn't even really know why I was doing. I knew I
sure.
enjoyed sciences and medicine, and I studied neuroscience, and I was fascinated by it all. I have a very sentimental and philosophical side that is a little bit more vulnerable and is hidden behind a wall of science,
Mhm.
self-protection. But then yesterday I thought to myself, my goodness, this is unbelievable that
Sure.
I can put this positive in people's lives,
Yeah,
and that they come and they tell me, so much of this is shaped by the culture too, unfortunately. I mean, just look at a Disney character, and based on the shape of their nose, you can
Sure.
tell if they're considered the good guy or the bad guy.
Yeah. 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 Yeah.
There's so many things that we just implant into young people's heads
Yep.
and the society as a whole. And yes, I'm blessed.
Well,
And
you're making, as I'm thinking about it now, I think you're making people whole. And
like,
we were talking about the whole of facial expressions, but yeah, I mean, in your line of work, you're making people whole. And so it's an amazing thing that's being done over there.
oh, thank you. It's lovely to hear this because I was a cancer and reconstructive surgeon before I did aesthetic surgery, and the transition was so hard for me, David, because I was in academic environments, and to leave that kind of world and come to a private practice and go into, and
Sure.
you always think, am I selling out? Am
Mm,
I? I'm no longer saving lives. And it
mm,
took me some time to realize that it's not always about saving a life in that way, but maybe there are other ways to
that's
improve
right.
a life and give better qualities of life.
Absolutely. Absolutely.
Da-
No question about it.
David, what a pleasure talking with you. I really, really enjoyed it. And your martial arts background, or well, foreground, because you've done it all your life, is amazing. It's
Yeah.
outstanding. I've always been fascinated by the martial arts and dabbled in them a little bit too. And it's just amazing what you've done. And your sons as well, right? They're into it too.
All my kids are into it. And my daughter is a
Yeah.
2008 Beijing Olympian.
Oh
And
my goodness.
the three boys have their own records in the national scene of judo. And so
Amazing.
I'm very blessed to have that. And, it's a very humbling thing to be able to keep working out and to keep yourself in shape, but keep yourself grounded. I mean, judo for me has always helped me ground myself because it's easy to be in the academic world and deal with the clouds, right?
Yeah,
Everything goes away when you get on the mat and it's just you and somebody else.
that's it. That
Yeah,
moment of silence.
there you go.
Well,
I'm glad we talked about the social aspects of the reconstruction and all the
yeah,
other kinds of technical things that you do. I mean, we can talk about expressions and emotions forever and ever, but
yeah,
putting it together for people and making people whole on that is like just an amazing thing. So I'm
I
glad
think
we
so
touched
too.
on that later on.
Super cool. All right. Yeah, I
You take
enjoyed
care.
speaking with you.
Yeah,
We'll figure
yeah.
something out.
All right, man.
Thank you for your time. Enjoyed it. If you found this conversation and conversations like it interesting, please subscribe. This is the Face Podcast. I'm your host, Masoud Saman.